Hello and good evening, I'm Melisa Idris.
And I'm Sharaad Kuttan.
You're watching Consider This, the show where we want you to consider and then you consider what you know of the news of the day. Now, after 1 year of being on the front lines of the fight against COVID-19, healthcare workers say they are flagging. Responses to an anonymous online survey of frontliners, which was conducted by Project Wawasan Rakyat and ABIM last week, saw expressions of frustration and exhaustion. Respondents say they are understaffed, overworked, and underpaid, all while working in overcrowded hospitals with compromised patient care. Now, how do we best support and protect our frontline healthcare workers beyond just lip service? Dr Safurah Jaafar is the former director of the Family Health Development Division under the Ministry of Health. Good evening, Dr. Safurah. Thank you so much for joining us on the show tonight. Now, I'd like to begin our conversation by looking at the situation even before the pandemic. So even then, there were reports of budget cuts and staff shortages, of patient overcrowding, and of healthcare facilities in disrepair. Now, would it be fair to say that our healthcare system was already stretched to its limits, and that what we're witnessing today is perhaps part of those long-standing problems?
Well, thank you, Melissa. Thank you for having me. Yeah, the healthcare system has actually developed in congruence with, in line, parallel with our economic development. And I think the system has improved tremendously. I used to work like 40 years ago in a small clinic or a hospital which has very little facilities. But over the years, it has grown, and I think it has increased and gained a lot of trust from the community. I think we had the helm of the development in the 80s and 90s, but after that, we continued to grow. But the community start having, of course, increased trust in the public system, particularly I'm talking about the public system. But at the same time, there was economic challenges. So there was this shift, a lot of shift from, a lot of the community coming into the public system. So yes, we've got that strain for a while, but I think the flexibility of work and the genuine interest of the staff to contribute, despite the workload, they try to accommodate. If to last year the attendance was say 100, and this year the attendance is 150 with the same number of staff, they will try to maneuver around, to attend as much as they could. But I think, and even during when we had epidemics, all right, we have epidemics like the SARS, the H1N1, we gain competence, all right, and we develop our competence. And I think even during that time, the community, the staff were able to manage. There will be redeployment. The moment there's an epidemic, there will be immediate the bilik gerakan will be initiated. People just know, and people just fall in place how to do it. But those are short-lived epidemics, short-lived crises, and the number of patients and the number of consumers, or clients we call it, has increased. But the number of staff increase is not the same as the kind of workload that we are facing. And that
Dr. Safurah, sorry if I can interject. What I do want to ask you is that you participated in this webinar yesterday, Project Wawasan Rakyat and ABIM, Angkatan Belia Islam Malaysia, and you heard all those readings of people, testimonials of people expressing their feelings. Are those real? Are those genuine? I mean, should we be very concerned that medical frontliners are feel so under pressure at this point in time?
Yes, definitely. I mean, things are getting worse by the day. When we talk about in March, June last year, I think when we are seeing the cases down, despite all the hard work the staff put in, the moment they saw the decline in cases, there is hope. There is hope that, things will go back to normal and they will get back, a little bit of free time, a little bit of family time, a better work situation. But unfortunately, things got worse. And whatever they have said, these are true situations. It is a true reflection of what is happening majority of the hospitals.
Right. You pointed out, Dr. Safurah, that this is not a short-term battle that healthcare workers are dealing with. It's been a year that they've had to deal with the grueling hours and the increased workload. I'm wondering, this survey that Sharaad just referenced, it was an anonymous survey, and I'm wondering whether frontline workers feel that they have to express their frustrations and their exhaustion through an anonymous survey. Do they have an avenue to raise their hands and say that they are burning out, that they are under immense stress? Is there an avenue for frontline workers?
Well, I would say there is, but maybe not the formal mechanism and not maybe the mainstream mechanism. They may have added it to their head of departments. They may have added it to their state directors, but maybe jumping across, the various line of authority may not be something that is easily done by the frontliners. So, of course, I think I would say that there is some limitations for them to actually see what they would like to, the genuine feeling or the frustration that they are having. And I think,
Dr. Safurah, I want to ask you about that because, you've been in the system for a long time, or you were in the system for a long time. Is it a very authoritarian culture within the Ministry of Health? Or is it one that is inclusive, that is welcoming of dissent and diversity of opinion? What exactly does the Ministry of Health look like from the inside?
I think you could see it like in two situations. Number one, I think within the ministry, I think there's free flow of discussion because I think they are professionals. They do accept comments, and especially when the Ministry of Health, in particular when I'm talking about Ministry of Health, we are looking at quality assurance, quality improvement. Therefore, definitely all these gaps and weaknesses are always being identified. However, but when you look into the bigger picture of being in a government servant, and I think that is where the limitation comes in. There are certain government servants, you're subjected to certain rules and regulation. It's not easy for one to raise this in the social media, whatever frustration they have. Of course, we have this melalui saluran tertentu. I'm sure you have heard of that. So I think that is prevalent in the ministry and most ministries anyway.
Thank you so much for joining us on the show tonight. We really do appreciate you sharing your insights with us. Thank you. We're going to take a quick break here on Consider This, but we will be back with more on this topic, so stay tuned. Hi, welcome back to Consider This. I'm Melisa Idris. With me is Sharaad Kuttan. Let's continue our conversation about the situation of medical frontliners in the fight against the COVID-19 pandemic 1 year on. Dr. Thum is advisor to Malaysian Medics International, which is a medical student-led organization, and he joins us on the line now. Good evening, Sean. Now, we want to talk a little bit about what you've heard in terms of concerns raised by frontliners who may be facing burnout after 1 year dealing with this pandemic.
Good evening, Melissa. Thank you. Well, I must say that I am grateful that I myself have been well taken care of. There's this recent survey by Power and ABIM that describes some concerns by frontliners who participated. They cited a challenging workload made tougher when staff members contract COVID-19 or had to undergo quarantine. May lead to stress and burnout. Now, what I want to highlight here is as healthcare professionals, the major concern for us is the patient. The term frontliner for healthcare providers is a misnomer. We at hospitals are actually the last line of defense. If we fall, society is going to be affected. Now, looking at the increasing number of patients, the concern is also whether our resources, including and especially manpower, are adequate to help our patients. After all, while the focus is fixated on efforts to combat COVID-19, we should not be forgetting that other conditions like cancer or other chronic diseases are still happening.
Sean, but can we come back to the reality that doctors and nurses and those working in hospitals face? I mean, yes, patients are your first priority. You say that as a professional, but you're also human and you're also social. You have other responsibilities as parents, as children, members of a community and whatnot. So is it fair to have a system that isn't sustainable for the well-being of the people who work within it? Is that the crux of the complaints that are coming through? That it's not just that it's a terrible situation and people have to do extraordinary things and make sacrifices, but this is unsustainable.
Well, we have to understand that this is KKM is an enormous organization, and sometimes situations may be a little bit challenging for our staff members, and that happens everywhere. Now, people do have avenues to raise concerns, and it is very important for us in terms of our mental health and our performance for us to actually raise our discomfort, our concerns when it's required. So internally, there is a hierarchy for us, where the house officers can complain to medical officers, then go up to specialists, then go to head of department. After that, you go to pengurusan, and then if that's not being able to be solved, you go up to JKN or the Ministry of Health. Now, healthcare workers, especially doctors, do have other avenues to submit their concerns. The Malaysian Medical Association, SCOMOS, to have this help doc system whereby doctors can submit their complaints. There is too the system pengurusan aduan awam, where people can actually provide their feedback, whether positive or negative, and it will be sorted out accordingly.
Right. I mean, I know there are, official avenues to air the complaints, but how much of those avenues are then acted on? I think that's the question. We want to know whether rules and decisions and resources are being allocated, knowing the lived experiences of those on the front lines.
That's actually a very difficult answer for me to question for me to answer, but. I think
fair. Maybe you can just try and tell us where you would like to see the most resources and help funneled to.
Right. In terms of resources, there are actually two major places where I would like to see here. I think the right question is, what can we do to make our healthcare providers feel safe and appreciated? So I will answer based on one thing: job security. Secondly, taking care of the welfare and of our healthcare providers. So in terms of job security, I would like to first praise the ministry in taking care of taking in healthcare workers to assist with controlling the situation. However, a significant number of them involved are actually on short-term contracts. So the question here is, what happens when the contract ends, even when the pandemic is over? Now, secondly, in terms of taking care of the welfare of healthcare providers, we have to ensure that our healthcare providers actually receive sufficient rest. Ensuring that they have a minimum of 1 full day off per week is very important. It allows their mind to actually not think of COVID for 1 full day. Other terms of welfare comes in the form of payments. In terms of, there are a lot of complaints from healthcare workers saying that they are paying at a pay grade lower than what they are supposed to receive. Now, if we are able to harmonize the pay to the level where there's where it's supposed, at the supposed level, that would be much better.
Sure, sorry to interject, but in yesterday's program, in which I believe you participated, there was a very interesting comment that came through, which was that healthcare workers are not asking for leave even when they feel they have legitimate reasons to. There's a lot of there's a censoring of people's desires. And I'm wondering if, in many ways, we have created this situation where we hero worship frontliners, but then we have made them mute, that we have effectively silenced them by turning them into heroes and superheroes with, impossible expectations heaped on them.
Yeah, that's the danger that could have happened. So it is very important when our frontliners speak, we have to listen, and it's not just us, but also the people in power, the people who have the ability to make these changes have to listen as well.
Right. Well, you brought up mental health a little bit earlier, Sean, and I can
Yes.
only imagine the strain and the fatigue of having to deal with illnesses on a daily basis under really challenging working conditions and for a prolonged period of time. It's been a year dealing with this pandemic. Doesn't seem to be going away anytime soon. Talk to us a little bit about some of the concerns that you may have about your fellow your medical frontliners in terms of their mental health and what support can be provided for that.
Right. Thank you, Melisa. Stress exists, yeah? The key here is to actually resolve stresses that we face. Now, but what happens if this stress is prolonged and excessive? The person will actually experience a state of emotional, physical, and actually mental exhaustion, which is what we call burnout. Now, for a person who is experiencing burnout usually feels overwhelmed, emotionally drained, and is not able to perform to their abilities. So working in the COVID-19 front lines, we're actually faced with a lot of concerns. Number one, we are worried about contracting the virus and then bringing it home. We are worried about the general condition. We are getting 3,000 plus 4,000 cases per day. We are actually very worried about the situation over the country. KKM actually do have this mental health psychosocial support initiative called MHPSS, set up at every institution. They provide this thing called psychological first aid, PFA for short, which actually aims to link the person, their concerns, and to the things that they can use to actually improve the situation. If anyone feels that they are in need of help, they can actually contact their MHPSS service in their institution. Now, MMA Help Doc does provide this service as well for people to contact them if required. Mercy Malaysia has this psychosocial support hotline as well as befrienders.
Okay.
You can contact them.
So there are avenues, there are resources. All right, Sean, thank you so much for joining us on the show tonight. We really do appreciate your time. We're going to be back with more on Consider This. Don't go anywhere. Stay tuned. Thanks so much for staying with Sharaad and I on Consider This. Dr. Adriana Tan joins us on the line now. She's the Vice President of MMI Doctors, which is a branch of Malaysian Medics International. Dr. Adriana, welcome to the show. Thank you for joining us tonight. Now, I'm wondering, when stories of what's really happening in public hospitals filter through the medical fraternity, how does that affect the morale of the next generation of practitioners?
Right. First of all, thank you so much for having me on. So I think the whole situation, whatever stories that we've heard, I think we've heard some really good stories, some really rather distressing ones, and I think compounded by the fact that most of our frontliners, the healthcare workers, they're all under contract. And the fact that once their contract ends, for example, contract doctors, mostly they would have their contract ends in 2020. About 4,000 of them would actually end their contract in 2022. So this, I think, would give like a rather bleak future. So I think you can just imagine like working tirelessly day on end for the rakyat and having no job security at all. So I think this would actually affect their morale and also the younger generation as well. And on top of that, the whole contract scenario, I think, would also impact the future of the healthcare system, where we would actually have difficulty to meet the specialist needs. Right now, we are at 3.9 specialists per 10,000 per 10,000 population as of June 2020, as compared to the OECD Organization for Economics and for Economic Development, which suggests average of 12.3 specialists per 10,000 population.
Adriana, does this make you angry when you know that the pandemic has revealed all the structural and resource deficits in the system, and knowing that this pandemic is going to go on for a couple of years, and we might have other challenges of a public health nature in the future, that we are not addressing this issue of staffing, that we still are not treating the talent that we have in the system with enough respect, putting them, as you say, ensuring job security for them. Does it make you angry?
Honestly, I would say yes. And also, actually, it's rather heartbreaking. It's rather heartbreaking to hear stories every time and how it actually affects their physical and mental health. And for example, we actually have this exam for a prerequisite exam for masters. It's called MEDEX exam, and we actually most of them actually our frontliners. And when they announced that it was supposed to continue in January as usual, actually a lot of them had problems, not because on top of the MCO, actually all of them had concerns that what if they leave, they would actually burden the colleagues, and then there wouldn't be adequate care for the patients. So you can see that everyone's trying really their best to provide the best care, and I really commend the efforts by KKM so far. You can see that they're trying to harmonize the pay between UD43 and UD44. So I think that's great. And I think that we can always do better. There's always room for improvement. For example, sorry.
Adriana, early in the conversation, actually throughout the conversation tonight, we've raised the issue of whether doctors, medical practitioners, and frontliners have an avenue to raise concerns, frustrations, and worries about burnout and the immense pressure they're under. And I understand there are limitations as public servants. However, is this made worse in the younger cohort, for the younger doctors and nurses at the bottom of the pecking order? Does it feel like they have less of an avenue to raise concerns about burnout?
I think the avenues are there. I'm not sure if it was mentioned. We have CISPA, and if you KKM has this MHPSS, mental health support during COVID as well, and the online platform, which is the CISPA I mentioned, and we have also for organization. The avenues are there, and I think it's just whether or not they are comfortable and confident enough to provide any complaints or feedback, because there's always these concerns to whether there's any repercussions or disciplinary action. And I think with MMI doctors, we are always very excited to tell stories from the ground, stories from doctors about what it's like in the field and what's really going on. And I think it's actually quite interesting that every time we would actually get the same question, is it going to be anonymous? Because there's always concerns whether there's any repercussions for actually speaking up, which I think should not be that way. We really have to cure that culture. And I think it's really great that we see more and more organizations picking up about it also.
All right. Thank you so much, Adriana, for joining us on the show tonight. We really do appreciate your time. Thank you. That's all we have for you on this episode of Consider This. I'm Melisa Idris.
And I'm Sharaad Kuttan, signing off for the evening.
Thank you so much for watching and good night.